So your question is how I got in contact with qigong, zhineng qigong. I was seriously ill. I was in the hospital. Had a tumor cancer. I was treated with chemotherapy for the whole period when it was diagnosed. And then at a certain point, the doctors said, "Okay, we did our trick, and we cannot help you anymore because we got you the full treatment, and it worked till a certain amount, but it didn't clear it out. So you will have a problem now because you will die soon." and I didn't take that for granted. So then the same day I started searching for alternatives. I don't know how I actually got to Ooi, but I was emailing with Ooi at a certain point. And as he's explaining, he's very fast in replying. So he replied, I think, the next day already, because I explained my situation, like I'm ill, and he wrote back. I'm not even sure exactly what, but he asked me to send a picture, and then I think he could see it was serious.
Yes, I remember it very clearly because you are one of the very few who has that kind of a strong fighting spirit. Right? I remember that you wrote to me, why I asked for the photograph is because that as a qigong therapist, we normally scan you through. I can pick up the information from your picture and see how are you doing. See? Now this is something that some people ask me, how can you tell from that? So sometimes I tell them that, do you speak Arabic? Do you read Arabic? You don't. But if you learn, you can. So it's the same thing. I learn, and I can from the picture I can pick up many things.
Yeah, and then I started practicing actually. So just blindly believing or just trying it out also, and also researching actually to what is the purpose of this cancer. What is, because that you can feel it, like, okay, you ask the doctors why do I have cancer, and then they say if you find out you will get a Nobel Prize. But then at a certain point I was curing myself, so I was a kind of walking miracle, and I went to the hospital for checkups, and then I want to explain them how I was curing, and then they were like almost like closing their eyes and singing, because they didn't want to hear this, because it was like against their own way of thinking. So you have the diagnosis of cancer, then I had a period of treatment. I think that was 4 months, and then I was practicing for 6 or 7 months qigong, where it was all the time getting less and getting less. And then at a certain point it was over, and then the doctors said to me, okay, now we can do a surgery, because then we can get out of the rest material, because the tumor was as big as a football. So you have some rest material inside of you, dead material. But they believed, of course, within this dead material, there's probably some active cells. But I told them no.
So did you teach him how to scan himself?
No, I don't recall teaching him. But this is part of the practice, because in qigong practice you focus inward, and the ability to perceive our body is something that we have it at birth. It's just that nobody tells us that you have this ability. Nobody teaches us to do this. But qigong practice is all about inward focusing, meaning you focus onto your body, you focus onto your life activities, by your breathing, by your movement. And in comprehensive form, you use the word comprehensive, meaning things like what zhineng qigong is all about. Somehow, some way, if you practice well enough, like I have a friend here, you're talking about 8 hours a day. It's like his job, you know. It's very difficult for you not to develop that kind of ability.
Was it like there are those different two concepts? The one was the medical one from your heritage,
Yeah.
where you lived, and the other one was the qigong concept of looking at health, looking at sickness. So you were traveling in between those two concepts, or have you been just shifting to the other one?
No, yeah. And that's also the strong point, I think, of Ooi. He is always explaining it also from both the medical world and also both the what do you call it, zhineng way of looking at it, or holistic way of looking at it. And that is, of course, and that you don't have to say the one world is not true, one world is not true. I think both worlds have their abilities, because even the chemotherapy was for me very needed, because I needed the time to find out about qigong. So yeah, that's why it was needed.
Before we met, we communicated through emails and all that. You can see the change in him. With the practice that's going into him, we say in qigong there's no independent body and no independent mind. So when your health is getting better, so will your willpower in most cases. So in his case, somehow at that stage, he already knew how to handle the things like, the relationship with the family, the emotion problem and all this. And to us, that is the one big factor. You can settle this, half the battle is won. And then with the kind of practice that he's putting in fact, at that point, I don't see any reason why you can't get well. I still remember your marker was just slightly more than 10. Below 10 is normal.
Yeah.
Something like that.
Yeah.
Yeah.
Yeah, that was true, yeah.
Yeah.
And it was starting, when I was started, I think it was 160. And 160, that's, and when I was getting into the hospital, it was 16,000, something like this. So the doctors already helped me a lot, but the last 160, if you normally you get into the hospital with 160 and you get the full treatment. So still it was like, an adventure.